By the end of this class, you will already understand this lab. What are some of the important biomarkers? What should you be looking for as a functional tool? So with that being said, let's dive into first, what are the key benefits for this particular lab? It's one of the most comprehensive lab assessments that is available, integrates a view of multiple systems, such as our gut, our neurotransmitter, our detoxification, environmental factors, nutritional deficiencies, cellular function, utilization of glucose or fats. So it is such a comprehensive tool.
So let's take a look at the very first page. This is like the first page you'll see when the results come back in. And on this page, you see these functional imbalance scores. They're going to help us as practitioners quickly identify which systems are essentially under the highest amount of stress, and then what should be prioritized. Sometimes when you get these tests back, depending on your patient's background, their picture, what's going on, you may have a lot of these sections come back in the red. I wouldn't recommend focusing on all 5 of those sections. I would say you may just pick 2 to focus on at a time as you go through different phases of their protocols, because it's really overwhelming for you as a practitioner to figure it all out and do it all at the same time, kind of throw the kitchen sink at them. And then also it's even more overwhelming for patients to do all the things and try to remember why they're doing all the things. So I would say just focus on 2 areas, and then you can kind of work the other areas in as needed, or in like the second phase of the protocol, however you want to do that, because I have seen that before where all of them will come back red. So in this section, you can see oxidative stress, so that first one on the left, mitochondrial dysfunction, omega imbalance, toxic exposure, methylation imbalance. And like Dr. Tal mentioned, this is not a diagnostic test, but it's just kind of a way to understand what to prioritize clinically for your patients with functional medicine. So in this example specifically, you're going to see that number 8 in the red. So that's letting us know there's a very high need for inflammation. So whenever something goes 8 to 10, it's typically like alert. This is an area that needs to be supported. The rest also kind of show some, like the yellow is more moderate. The green is like there's not really a need for support here. But yellow and red definitely should be kind of targeted and focused on. So in this example, the lab is going to show very high need for inflammation support and a higher need for a reduced toxin exposure. That's that level 7 to the right of that red 8 circle. So this is going to tell us that the dominant drivers of the dysfunction are not isolated nutrient deficiencies, but maybe ongoing inflammatory signaling and exposure, toxin exposure related like metabolic stress. So how we would interpret this, we would say, okay, the inflammation picture is higher. So this may indicate this person has upregulated inflammatory pathways, increased oxidative stress, which is secondary to inflammation. They may have a higher metabolic demand for anti-inflammatory and antioxidant systems. And because of this, they may also have a slower recovery from physiological stress. So when reduced exposure support is high, the toxin exposure piece, this may suggest essentially ongoing exposure to environmental, dietary, or endogenous toxins, or this person may have an increased need for detoxification, a higher reliance on things like glutathione and methylation dependent pathways. So sometimes it's, we're thinking, hey, does this person have an issue with their glutathione picture? What's happening there? Maybe that's what we need to support this detox picture. Maybe there's something directly causing an environmental exposure or uptick in that toxin picture. So there's many ways to think of it. And then also, it could also suggest that the system is compensating, but it's under some strain. And so as practitioners, when you're thinking of kind of your care plan, rather focusing on, only on energy production or, single nutrients, this pattern can help us prioritize that the major kind of themes we want to think about, right? So one, we want to think, hey, this person, we would love to see this 8 come down to maybe a 5 or come down to a 0, right? But we want to see the numbers going down. So we need to reduce those inflammatory triggers. So we're going to talk to them about their diet. What are you eating? Are there bigger dietary inflammatory loads there? Are there a lot of processed foods? Are there a lot of poor quality meats if they're doing those types of things? We're going to talk about lifestyle stressors. What's your lifestyle like? What's your sleep quality like? What's your, interpersonal relationships like? What are the bigger stressors for you? We want to talk about, sleep is a really big one too, for kind of a trigger for inflammatory stress, that whole cortisol picture and how that happens. So definitely those are just kind of some simple ways we think about how to start talking about that inflammatory scenario. For the toxin picture, we're thinking, what could this person be exposed to? So we think about where they live. We think about if they live in a factory town, farming town. We're thinking about the types of produce that they're eating. Are they eating mostly like pesticide-laden products? Could it be their job? Where do they work? Things like that. Those are the basic starting points for those environmental toxin inputs. And then we're thinking about, does this person just have issues with like maybe clearance of the toxin? So is that what we're thinking liver? Are we thinking gut issues? Are we thinking kidney? Are we thinking glutathione, antioxidant systems are just a little rusty, so they need more support with upregulating those so that those organs can do their jobs? We think, okay, how do we support this person's ability to detox properly without being overly aggressive with our protocols? So we think about supportive strategies that are already aligned with where the patient is at, and just kind of naturally supporting those organs that are already existing in the body. So how do we naturally support liver and help upregulate liver health? But that could be many different ways. How do we upregulate their gut health, right? We think, hey, does this person need some gut antimicrobial support? Do they need some probiotics, things like that? How do we do that with their diet? And then we just kind of sequence the care appropriately, right? So we want to address the inflammation and exposure first, and then after that we can go to whatever else may kind of be highlighting there. So that could be the methylation picture or mitochondrial picture, or if you wanted to, kind of loop them in together, sometimes that's okay, especially for methylation pieces. But I would say I would not do everything at once if all of these come back for your patients. Most of the time that's not the case, but I would say you want to prioritize the things that are more in the red and the yellow to start. So in other words, this page is going to help us as clinicians answer the question, what is stressing the system the most right now? And then we're going to build a care plan that's going to remove those obstacles before we actually, add support.
First page is really great for the general overview. And then from there, we're going to start going into each section separately. This is the nutritional deficiencies and digestive support. And so you can see here in the page, this is where we're not necessarily measuring the dietary intake measurements or serum nutritional level, although there is an add-on to this test, which is a blood sample, which gives you much more in detail the nutritional levels, but they essentially reflect how hard the body is working to maintain metabolic balance and which nutrient appear to be in higher demand for your patient. And so you can see here, for example, you can see there's the green reference range, and then there's also the yellow, which is higher need, and then there's the red, which indicates a much higher need for those. So we typically focus on the ones that are higher demand, which is the on the right scale of the yellow reference range and the red. And you can see here vitamin B1, B2, magnesium, and omega-3 fatty acids, along with high need for digestive support. So as clinicians, it's the best thing you can do is invest in a good training that shows you the indication of the function of each one of those. So when you see those on the labs, they don't just indicate the deficiency of B1 or B2 or magnesium. You now have a deeper understanding of what are those nutrients required for.
So let's look at page 7 of the report, which is typically where we find these details. So page 7 is going to map cellular energy production. So it's going to show us how the carbohydrates, the fats, and the protein feed into the mitochondria. So when I talk to patients or go over their reports with them, I'll just kind of try to make it as simple as possible. I'll say, if you have some rice, this is the carb section. This is how it's going to be breaking down. If you're eating a piece of chicken or some beans, this is a protein picture. This is how this is going to be breaking down and feeding into, just to make it make more sense to them. But essentially, we're looking at this section to look at the citric acid cycle intermediates, fatty acid beta oxidation markers, electron transport chain indicators. These are all mitochondrial aspects. And then oxidative damage markers like your lipid peroxides and your 8-hydroxydeguanine markers as well. So just I know that sounds like really scientific, but just know this is all kind of an insight into mitochondrial health, which you want to know about when patients have chronic illnesses. You want to know what their mitochondrial processes are doing. So the key things to listen for the most part, chronic fatigue for patients with mitochondrial issues, exercise intolerance, right? Post-exertional malaise are things we think about for, is there some kind of mitochondrial imbalance happening here? And then the markers such as lactate, pyruvate, or the TCA intermediates, or could be out of range. So I would definitely say this is a really important page for you to look at and reference, because it also is going to include where the vitamins are important for that particular cycle, and it'll tell you what's happening at the level of that cycle.
Let's go in, with that being said, let's go into the next page. This is where we're going to talk about organic acids and functional systems. So this is page 8 and 9. We're going to show you a picture of what that looks like, so you have a visual right in front of you. We love using visuals because it really helps us to focus on what it is that we would want to address. And you can see here, this is really a part of the core of the Metabolomix report. And you can see which system might be impacted the most and where you want to focus your time, effort, and the patients you want to focus on their finances and supplements or nutritional dietary changes the most. So let's take a look at these. We can see here, this is the kind of breakdown. You can see on the top left, I know there's a lot of data here, but we're going to try and break it down. The top left, you can see malabsorption and dysbiosis. This is going to be mostly focused on the gut. And so when you look at these, when we look at the gut, we can see that the key biomarker here that is marked as there's multiple different biomarkers here, but one of those that is marked off is the DHPPA. Now, of course, there are multiple biomarkers here. We're not going to address all of them because then we'll be here for a few hours. And so as a note, just note that the key biomarker, and this is something that the labs don't typically tell you, but the key biomarker here is D-arabinitol. This is one of the key biomarkers, which is a yeast-derived organic acid used as a marker of fungal overgrowth and carbohydrate fermentation. So that's one of them. The one that we're going to talk about is the DHPPA, which in this lab, you can see it is elevated. This is the third biomarker right under dysbiosis marker from the top. And you can see that it's in the red range. And so what does it actually mean? It means it reflects an increase of bacterial fermentation in the gut, which is commonly associated with intestinal dysbiosis and impaired nutritional absorption. So when it's elevated, it means it could indicate a gut microbial that is alternation. We could refer to it as an indication, indirect indication for dysbiosis, meaning that there's overgrowth of certain bacteria because there's over-fermentation. There's also increased fermentation of amino acids and polyphenols and reduced efficiency of the nutrients absorption. Your patient might struggle with bloating or gas, brain fog.
Yeah, there's definitely a lot of data, but it's really, really useful. So I think this is one of the best tests we can use for our functional medicine clients. Okay, so let's talk about page 10, which is going to be the amino acids and protein metabolism. So this page is going to reflect like protein digestion, absorption, utilization, as well as downstream metabolic detoxification demands. So in this report on this page, we see several amino acids in the top left are out of range, pointed to impaired protein metabolism, increased stress demand, and then also altered methylation and membrane turnover, cellular membrane turnover. So the three most important amino acids to address would be our taurine, which is what we see as on the lower end, and then we're going to talk about taurine, we're going to talk about isoleucine, then we're going to talk about sarcosine, which is elevated. So the taurine is going to be a high priority. Why? Because low taurine can affect multiple systems at once. It can affect your bile acid conjugation. So that's, the breakdown of fats and absorption of fats, and then also thinking of fat-soluble vitamins, right? So if the patient's vitamin D, things like that. So that can give us insights there. This taurine also is going to impact antioxidants and your mitochondrial protection. It's going to impact the nervous system and how we regulate stress, and then also a patient's cardiometabolic stability. So because this patient's already showing in this section this digestive dysfunction, we've seen the mitochondrial inefficiency, then we know the inflammation, oxidative stress, we know that low taurine can amplify all of those problems simultaneously. So the clinical takeaway we would think is, if this taurine is not addressed, improvements in digestion and energy and detoxification may be really limited for this patient.
Thank you, Dr. Esha.
Yeah.
And I know that probably some of the practitioners that are watching this class today are thinking to themselves, "Wow, there's so much data in this in this lab test that it could feel overwhelming at some point." But I would probably say take whatever you can from our class today, and even if you just put it kind of in the back of your head for later, that's also still okay. Just know that you don't need to memorize this information. In the functional medicine program, we actually take you step by step. So we have a specific class review on cellular function, and then we go into where each one of those nutrients are playing a role in. And then we go into each one of those processes inside the cells and how you can optimize that. We give you very simple, straightforward, evidence-based protocols that you can use right away without overwhelming your patient. And then we also do case studies with you. And one of the coolest part is that this is really one of the only programs that include mentorship. So use it, like reach out to, in your platform, you can book a coaching call with Dr. Esha, who's bringing years of clinical experience. You also have Dr. Kim, who's a functional medicine nurse practitioner. So we have a team for you, and we are here to support you